Hi, welcome to this unique haircare initiative by IFCA. I'm Mona Sharma and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory. It makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle age when we used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing people having hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well, and much of the hair loss can be avoided. Today, we have with us Dr. Rakesh Nalla, is a well-known dermatologist, has been practicing medicine for over many years now. His MBBS MD specializes in dermatology, cosmetology, and trichology. Currently, he is practicing as a specialist doctor at SK Hospital, Assam. Dr. Nalla Rakesh has dedicated his career to diagnosing and treating a wide range of skin and hair conditions by providing personalized hair care services to his patient. He takes time to listen to his patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Rakesh is also aware of the need for the patient awareness and education about hair care and spend a lot of time in giving talks at various platforms across the country. Thank you, doctor, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to this YouTube live show.
Hi everybody, myself Dr. Rakesh Nalla.
Dr. Hamaisa Junekle Barba Shukriya. So today we are going to discuss about hair care in current scenario. And whenever we talk about hair care in current scenario, the very common problem which is faced by all of us is hair loss, irrespective of gender and age. So can you please explain us, like with your profound experience, like what is hair loss, where and what's normal and when to be concerned for?
Yeah, okay, hair is a very vast topic to discuss. Okay, now we can slowly talk about the hair. It is very interesting thing to know. Basic is the product of, it's a keratin basically. So it is a keratin is a protein. So nowadays most of the people are coming with this problem of hair loss. Like some people actually have the problem and some people they think they have hair loss.
Hmm.
Okay, because there is a very clear line of demarcation between whether you have hair loss or not.
Hmm.
Okay,
Hmm.
so what if you see in the terms of count, hair count,
Hmm. Hmm.
generally we tell up to 100 hairs falling in
Hmm.
a day is a normal thing.
Okay.
Like if some people coming with like, sir, I'm having so much of hair fall, I'll ask them
Hmm.
how much, can you quantify it, how much? Like if they
Hmm.
feel like it is sir some 50 to 60, it is like normal only, because
Hmm.
without your knowledge, daily
Hmm.
more than up to 100 hair will fall. Okay,
Hmm.
if it is
Hmm.
increasing like more than 100, it is reaching up to 150 or 200, then you have to be concerned, like
Hmm.
some other cause may be there in this, because hair is actually, it is not a static thing, it is a dynamic
Hmm.
process of multiple cycles going through in our body and the hair. And also
Hmm.
environment has very good impact on the hair also. Like it's a
Hmm.
climatic thing. Like
Hmm.
usually in the winter there'll be hair fall, and in summer there'll be hair regrowth and all. So you have to see the climatic condition also to assess whether the patient is having hair loss or not. So basically one simple thing is like up to 100 hairs, no need
It's
to worry,
normal.
it is a normal
Hmm.
thing, you can go with it. But if it is
Hmm.
reaching more, like reaching up to, some people may have up to 1,000 hairs falling, like so much
Hmm.
of hair they can see while taking bath, can they
Hmm.
tough hair in their hand, then you have
Hmm.
to concern about this. So
Okay.
this is what hair loss basically.
Okay, so when it's more than 100 and you see lot of hair falling everywhere and people telling you, oh my God, your hair is everywhere. So it's time
Hmm.
to see the doctor. Okay, so doctor,
Yeah,
like
it's time
now
to go
that
with
we
it.
know like how to differentiate between this hair loss and like alarm sign of hair loss. So another very common question, like people who are prone to hair loss or already facing hair loss, they keep asking themselves, why me? Why it is happening to me? मेरे साथ ही क्यों हो रहा है? So like what are like general causes of hair loss? Why does it happen? Like why hair loss is so common?
Okay. To discuss before what is the cause of hair loss, we should know
Mm,
what is hair loss. Like, what are the different types of hair loss? What we can see in the
mm,
people.
mm,
Okay. If you in broad, if you divide, there are two types. One is scarring
mm,
alopecia and another is non-scarring alopecia. Scarring means there will be
mm,
scar.
mm,
Non-scarring there will be no scar, but there will be hair loss.
mm,
If going
mm,
to categorize what is the reason, if you see the non-scarring things like normal, the
mm,
main things
mm,
which come in that are male pattern hair loss and female pattern hair loss.
mm,
Okay, which both are due to androgenetic and genetic predisposition is there because of the hormones, and also genetic things are also there. Then after that, you can have some patchy loss of hair, which may be alopecia areata, or some people with psychiatric problem. There is something called trichotillomania, like they pull their own hair without knowing that they're pulling it. And another one most important thing nowadays, every woman is facing or men is facing, even children are facing, is telogen effluvium. Okay.
Okay.
When you broadly classify, this hair is divided into three cycles: anagen, catagen, and telogen. This is mainly. Another two other cycles are also, stages are also there. But this telogen effluvium is shedding of the telogen hair. Basically, because anagen is the phase where the hair will stay for many years. Suddenly, if it gets shifted to telogen, it will shed off. This is called
Okay.
telogen effluvium. This is how matlab, these non-scarring alopecias are divided. But when you go to scarring alopecias, there is multiple inflammatory diva. There is inflammation there, which damages everything, hair follicle and everything. There will be scarring. That most commonly we have something like DLE, and something was lichen planopilaris, something called central centrifugal alopecia, folliculitis decalvans, dissecting folliculitis, and numerous other causes are there. And then if we go to age-wise, what may be the reason? Age or sex. If you see the children most of the time, nowadays children are also having the hair fall. All parents will be so much concerned that children is having more hair falls on the. First thing we have to see is like genotrichosis. Matlab, any genetic disorder, whether it is causing any hair loss. Most of the most common things are like ectodermal dysplasia and kid syndrome. These syndromes are genetic syndrome. Okay, we can't go to that much far, but if you see the normal things, there will be patchy hair loss in children also. That is due to alopecia areata. And another thing is tinea capitis. That is a fungal infection of the hair. And another is the most common is nutritional deficiencies, because children are prone for more of the nutritional deficiencies. So it may lead to the main cause of the hair fall in the children also. And some children, even they will also have trichotillomania, which is the psychiatric problem where they will also pull out. Habit is a habit
Okay.
of pulling out the hair. It
Yeah.
causes the death. But when you go deep into the male actually they'll have the common thing is male pattern hair loss. That is,
Yeah.
it's a temporal recession. That is the correct in a different. There's a one cycle called Norwood Hamilton classification, where you have different 7 types of hair falls in the male pattern hair loss. Mainly it is due to the genetic predisposition, and mainly other reason is because of the hormone testosterone. Normally circulating hormone testosterone is of no problem, but when it gets converted into dihydrotestosterone because of some enzyme called 5-alpha reductase, this DHT, which enters your dermal papilla through blood. When it enters to the dermal papilla through blood, it goes and act on the receptors present in the dermal papilla, which will stimulate the dermal papilla. That will cause conversion of that hair follicle into miniaturation. Matlab, hair follicle size will slowly shrink and disappears. This is the main problem with the DHT. Okay.
Okay.
Uh, and also in females also this pathway happens, but not that much when compared to the males. So males pattern is completely different. But in females, okay, male is okay. They're coming with genetic predisposition, like more than if parents are having up to 80% or more than genetic predisposition is that offspring may have this problem. And another problem you can see in the females is viralization. Viralization means if there is anything called PCOD, like female is coming with hair fall, it is not that just hair fall. We have to diagnose in the deep thing what is happening in the dysfunction. We have to see whether she is having any viralizing tumors by doing ultrasonography of their ovaries and all, or she may presenting with excess hemorrhage during the menses, and it may lead to iron deficiency anemia, or whether she is having some condition called anorexia nervosa or bulimia. Okay, in there where they will do binge eating and they will do vomiting, and there is some complete loss of nutrients, and they're also not taking the proper diet. Or whether she is having some autoimmune diseases like systemic lupus erythematosus SLE, or any dermatomyositis, or any normal infections that is happening. But overall, if you see in male, the most common if you go with this male pattern baldness. In female, if you ask me, it is because of telogen effluvium. Now, so I want to tell more about this telogen effluvium, why it occurs basically. Telogen effluent usually occurs after 3 months of any trauma.
Mm.
Okay, this trauma may be anything. There may be physiological stress.
Yes.
Okay, suddenly three
Mm.
months back, they may have faced some very grave loss in their life. Okay,
Mm.
or
Mm.
anything, they may suffer from a physical illness 3 months back, like they have any suffer from very severe fever like COVID or typhoid or anything. And
Mm.
another thing, to get severe weight loss is seen in the last 3 months by doing the some crash diet. Okay, they followed some
Mm.
crash diet. They're not taking proper calories. No, they're not
Mm.
taking proper protein. Simply they're
Mm.
following some diet and doing. It
Mm.
will affect after 3 months, because
Mm.
there is anagen will suddenly push it to into telogen, and from there it fell down. Okay,
Mm.
and another one reason is postpartum. Why
Mm.
in postpartum females the hair fall occurs during the
Mm.
pregnancy?
Mm.
This anagen phase is prolonged, strong.
Oh, wow.
Okay, and suddenly pregnancy stops, ends, and like
Mm.
delivery over. Suddenly it gets
Mm.
shifted to
Mm.
telogen phase, and suddenly
Mm.
there is hair shedding and all.
Mm.
But this telogen effluvium is reversible. Okay, this is the only
Mm.
easy reversible thing. If you remove the stress, within
Mm.
3 months you'll get back your hair. Like
Okay.
she had fever, and now she's not having continuous fever. Okay,
Mm.
she's fine. And then she did diet 3 months back,
Mm.
but now if we improved her diet, she started
Mm.
taking normal food, calorie, proteins, and all. It will get improved over the time.
Okay.
Okay.
Okay. Mm.
These are the main reason what we see nowadays. In hormones, I have told, in alcohol also plays a main role. In
Mm.
especially in the females who are taking
Mm.
alcohol too much, there is so
Mm.
much of hair fall. Okay.
Okay. Mhm. Very interesting, doctor. I didn't knew that even there are some kind of disorder in which you stop eating and you lose lot of nutrients, and then your hair loss will prompt up. It's very interesting. And even I'm just thinking that I don't know whether this question is valid, but I really thinking that like at a certain age, like for example, a 60 age person, if he's 60 years of age and he's facing telogen effluvium, and will the hair grow back after the stressful period is over at at
Yeah.
that age?
Yeah, of course. Its age doesn't matter in this.
Matters
Okay.
for
Like
hair
60
growth.
years, 60 years you are telling, like 60 years, if it is not having any genetic predisposition to this androgenetic alopecia, and if it is clearly due to telogen effluvium, like he had some stress 3 months back, like fever or something, definitely
Mm-hmm.
it is reversible. Okay. If by
Okay.
just supplementing the nutrients and all, you
Okay.
can
Okay.
reverse it. But if you take the 60-year female, the situation is
Mm-hmm.
different. This is the post-menopausal period.
Yeah, right.
80% and more females are facing this what hair. Okay, the reasons are different in this, because there may be complete loss of estrogen after the
Mm-hmm.
menopause. The effect of estrogen decreases, so the hair
Mm-hmm.
will not grow anymore, it falls more, because estrogen is the one thing that is making to have what grow the hair on your scalp more. Okay.
Mm-hmm. So if you are facing any kind of hair loss, it's better to visit the doctor instead of thinking that it's just for a time period, it will go away. Very interesting,
No,
doctor.
people doesn't think like that. They actually directly go and buy these Adivasi oils, and they start applying these oils, and
Yeah,
they
we'll
come to
come
me
to
very
that.
regularly.
Yeah.
Yeah.
Yeah. So doctor,
Mm.
like another very, like there are so much of information like you're telling, and also there are so much of information on the internet, and on the public places also, people say that there is this treatment, that treatment, so people are quite confused. So can you please enlighten us today, like what medical treatment options are available for hair loss, like surgical or non-surgical, or is there any topical or oral losses we can use and manage our hair loss?
Yeah. Okay. Now we come to the management of hair loss. There is
Mm.
multiple options in the treatment. Okay. Then
Mhm.
we let's go into the step wise what you are seeing in the many of the people are seeing in Instagram that this and all. So okay.
Mhm.
Now I'll start with topical things like what we
Mhm.
can apply to improve
Mhm.
the hair fall. What the first thing is minoxidil. Okay.
Mhm.
It is a potent vasodilator, means it increases the blood flow to the scalp.
Mhm.
Okay, and these minoxidil comes in combination with some finasteride, which is an
Mhm.
anti-androgens. Like it goes and
Mhm.
block this 5 alpha reductase, what I have told you in before, which converts
Oh,
the
yeah.
THT.
HT.
This goes and block that,
Mhm.
so it actually prevents the miniaturation. This is the first thing, minoxidil plus finasteride.
Mhm.
And Before, like, I want to tell something about minoxidil. What people see, so many people are, it is freely available everywhere. If you open the
Mm.
Instagram, every non-specialist, some influencer is starting telling me, take minoxidil, apply minoxidil. See,
Yeah.
it's not like
Yeah.
simply applying minoxidil. So one
Yeah.
funda is clear. See, if you are
Mm.
having hair loss,
Mhm.
if you are having baldness,
Mm.
after 2 to if you think that after 3 months there will be
Mm.
complete hair fall,
Mm.
there'll
Mm.
be one stage like there is some complete baldness.
Mm.
If you start applying minoxidil, you
Mm.
have to apply lifelong,
Mm.
first thing.
Mm. Mhm.
Okay, if
Okay.
you stop suddenly, you've applied for 6 months, let's take you applied for 6 months, your hair is
Mm.
like fine, you grow, like after six
Mm.
months you stop using it.
Mm.
Okay,
Mm.
within next 3 months it will come to the stage where it should have been 3 months before.
Mm.
Did you understand it? Like
Yeah.
it will come to that stage like how naturally it should have ended.
Mhm.
See, God has made this natural plan like you should go bald at this place this time.
Mm.
By
Mhm.
using minoxidil, you are extending this God's plan little
Yeah.
further. But if you
Mhm.
continue include this minoxidil in your regular plan, like
Mhm.
regular routine for lifelong, okay, how many
Mm.
days you use, you can have this. Like minoxidil is not like it doesn't work on everyone. Like some people may
Mhm.
not respond to minoxidil. You have to find
Mhm.
out why it is not responding. There are multiple combinations with minoxidil, and
Mhm.
this is a complete approach. It's not like if you are getting in online minoxidil, you will go and buy and apply. The
Mhm.
story is actually very deep when you go
Mm.
deep into the minoxidil. Combination
Mm.
is finasteride. This okay. This then
Mm.
we go about hair growth serums. Like
Mm.
wherever you see, you'll see multiple serums.
Mm.
Uh, so let me tell about some few things which are usually seen
Mm.
in the growth serums.
Mm.
Commonly famous, like Procapil,
Mm.
one thing. It
Mm.
is also acts like uh, what our finasteride, like how
Mhm.
finasteride blocks this alpha reductase. This
Mhm.
Procapil also go and blocks the DST, and there's
Mhm.
something called redensil, which is actually stem
Mhm.
cell activator, and
Okay.
something called caffeine. Caffeine and definitely will increase. Caffeine is the best thing I advise. Then there come three things like anagen, capexil, and bicapil. These
Mhm.
three things, they actually balance between the anagel and telogen head. Okay,
Mhm.
and
Mhm.
nowadays the recently trending thing is rosemary oil. Okay, this
Mhm.
all comes under group, like everything has its own effect and trials and errors. Some studies are there, some studies are not. There is a collective thing. Okay,
Same here.
uh,
Mhm.
this is about the topical things what you are there in nowadays. After
Mhm.
this, if you want to know about non-surgical things, like
Things, yeah.
people sometimes non-surgical things, they don't want hair transplantation. Like hair transplant is the last approach where you need to transplant the
Mhm.
follicles of your own
Mhm.
hair taken from
Mhm.
your occipital region and transplant here in the front.
Mhm.
But before that, there is something called non-surgical things. In that,
Mhm.
most important thing is PRP, that is
Mhm.
platelet-rich plasma. And if you
Mhm.
there will inject the platelets
Mhm.
of your own by separating it from your blood. And after
Mhm.
these platelet, if you go for another therapy called GFC therapy, where this
Mhm.
is an advanced form of PRP, you can get
Mhm.
more growth activators. And nowadays, there's something called more advanced that is called IPRF, this platelet-rich
Okay.
fibrate. These are the
Okay.
three injectable things, and along that stem cell activators also you can inject. And
Mhm.
something is nowadays trending is two things.
Mhm.
One is PDO threads.
Mhm.
Threads, these are mainly made up of polydioxanone threads. Actually,
Mhm.
threads are usually used for our face to do the facelift or any scar revisions and everything. They have found
Mhm.
that if you are given in the hair loss, like if you're giving the threads in the hair loss, they're
Mhm.
also stimulating the hair. These are
Mhm.
the new thing. And another thing is exosomes. What is this exosome? This is the
Mhm.
future of therapy. Like exosome is like our fat cell derived mesenchymal stem cell. Matlab from your fat cell, we are getting some stem cell. So basically,
Mhm.
stem cell can become anything. You can convert
Mhm.
it into anything
Mhm.
like this. So
Mhm.
like that, this stem cell will eventually convert into hair follicle. So this is
Mhm.
also very good newer technique, non-surgical thing.
Okay.
And another one therapy is called low level laser therapy. Matlab,
Mhm.
you can give the laser therapy in combination with
Mhm.
finasteride. Orally
Okay.
also you will give finasteride, and that
Okay.
works together very good. These are all the
Okay.
matlab, non-surgical. When you come to the
Mhm.
surgical, there is definitely hair transplantation is the gold standard. You can go for it from experienced doctors, and NMC tells only a plastic surgeon and a dermatologist is allowed to do this hair transplant. Please know who is doing your hair transplant before getting it done, because
Mhm.
it is not that easy,
Mm-hmm.
because it may lead to vast side effects, and people eventually died many times during hair transplant if they are getting from some non-experienced
Mm-hmm.
technicians or without non. Be
Yeah.
careful in getting this therapy. Okay.
Very interesting, doctor. Even like we thought that laser is only for getting rid of hair, but laser is also for growing the hair back.
Yeah.
Yeah, very interesting, doctor. So, doctor, there is one word called nutraceutical, which is getting a lot of focus nowadays. So, can you please enlighten us, like, what is the role of this nutraceuticals? And also, like, there are so many nutrients, like macro, micro nutrients. So, are they very useful in hair health?
Yeah. So what is nutraceutical actually means? These are the natural nutrients which are formulated in the form of tablets or capsules or gummies or any multiple pharmaceutical ways. Okay.
Mm-hmm.
And nutraceutical main focus should be on the one thing, that is biotin. Okay. This is the
Mm-hmm.
vitamin B7. It
Mm-hmm.
actually required for the keratin synthesis that actually makes your hair and nail grow very nicely. And the recommended dietary allowance of these biotin is about 35 to 70 mcg. Okay, if you
Mm-hmm.
want to take naturally, how to take it from like eggs. Egg yolk is the main best source, or you can
Mm-hmm.
take meat and meat products, or legumes and nuts. Okay,
Mm-hmm.
but main thing, it is actually produced by our own body, like normal our gut flora, the bacteria which is
Mm-hmm.
there in our blood, it actually produces the biotin. Okay, so
Mm-hmm.
when you get this biotin deficiency, I'm going to explain very easily. Like if some people are there, like the gym freaks, they actually take the raw eggs without any matlab, uh, you have to cook the egg raw without any cooking or anything or something. They take raw eggs. The raw eggs, there is something called albidin. This
Mm-hmm.
albidin which goes and bind with the biotin.
Mm-hmm.
And when you eat also, it will not release it, so there is no use of eating it. Such people,
Eating.
they have biotin deficiency, so we have
Yeah.
to matlab, no, don't eat the raw eggs. If you don't
Take
eat
the
raw eggs,
active.
you can yeah,
Mm-hmm.
boiled egg is the best thing, because in by boiling, the albidin get destroyed, so you can easily take the biotin. And
Mm-hmm.
some people will take excess antibiotics. Just if they get
Mm-hmm.
fever, they'll go to pharmacy, they'll take azithromycin or something.
I'm not
Continuously if you
specialist.
take,
Yeah.
yeah, if you continuously take antibiotics, what they do, there is a normal good bacteria and bad bacteria in our stomach. Instead
Mm-hmm.
of killing the bad bacteria, they'll go and kill the good bacteria.
Mm-hmm.
If the good bacteria is dead, they can't produce biotin. It's
Mm-hmm.
okay. This is one of the reason why there is a. And another one important thing I forgot to tell you, that this hair loss, telogen effluvium, the another main reason is drugs. Like if they're taking any tablets for some other reasons, multiple reasons, drugs can easily lead to this telogen effluvium also. Okay. And another nutrient I want to tell you about is the iron. Okay, iron is also important, and zinc is also important, and along with that, these essential fatty acids are also important. When you see the dietary allowance of zinc, daily you have to need 8 to 11 actually mg per day. And iron also you need to take 8 to 18 mg per day, and vitamin C you have to take about 90 mg per day, and B12 you have to need about 2.4 microgram per day. When you go for like another main nowadays main thing is like vitamin D. All the females who are coming to me, everyone is having vitamin D deficiency, because okay, nowadays outdoor activities are very less, like not like
Yes.
before days we are always been in out there doing some sports. So
Yeah.
early morning wake up, people are become the nightlife so much that they're not waking up in the morning to see the sunrise also. There is no production of vitamin D basic. So vitamin D actually is the main culprit in many of the people with hair loss. So when you correct the vitamin D also, there will be decrease in the hair loss in them also. And when you collectively take this all the nutrients, this is how we give the paper, the supplement, which will actually make up to their recommended dietary allowance, and so eventually leads to the decrease in the hair loss. These
Okay.
are about the
Very
micronutrients and nutraceuticals what are using nowadays.
interesting. So very interesting, doctor. So, doctor, like on internet and social media, there are so many plant extract like grapeseed, omega-3 fatty acid, and many other. So people buy those products and thinking that they will promote growth. So do they actually promote hair growth?
Yeah, in this topic, I want to tell like two things. One thing I have to tell that biotin we get from egg, yolk, and meat products, but there are some vegans nowadays. Many vegetarians are like who doesn't eat egg yolk.
Yeah.
So such people, they always go for green food. Like green food is a revolution in our life nowadays. If you see anything green, we think it is very healthy. The same
Okay.
way there are some plant extracts actually
Mhm.
promote the hair growth also. So one such
Mhm.
thing is Sesbania grandiflora, which actually rich
Mhm.
source of purity. Along with that,
Mhm.
something called grapeseed. It's actually grapeseed is also trending so much. What is
Mhm.
grapeseed actually? It is a
Mhm.
very good antioxidant, and also
Mhm.
is a contain. It consists of also fatty acids also, essential fatty
Mhm.
acids, and
Mhm.
it's actually guard our hair against the
Mhm.
pollution,
Mhm.
heat, and UV radiations.
Mhm.
And it keeps our, if you apply this grapeseed oil cream, it will actually
Mhm.
makes our scalp hydrated and also strong also sometimes.
Okay.
And
Mhm.
another one is the omega 3 fatty. Omega 3 fatty acids are like god for us, like skin and
Mhm.
hair or
Mhm.
nails, whatever it is.
Mhm.
If you have the essential fatty acid like omega 3 fatty acid, they'll be
Mhm.
always glowing. So
Mhm.
in that things, there are two things: docosa hexanoic acid and something called icosa pentanoic acid. Both are
Mhm.
derived from the fish. If you eat so much of fish oils or so much of fish, definitely you are glowing. So if you see the
Mhm.
regions where the people are eating so much of fish, the skin
Mhm.
actually very healthy compared to the people who are not
Mhm.
accessible to these fish and fish products.
Yeah.
This what actually it causes is
Mhm.
anti-inflammatory. Definitely, it goes and
Mhm.
inhibits the pro-inflammatory pathways and actually
Mhm.
stimulates all the good things. So omega
Mhm.
3 fatty acids and grape seeds was a very good inclusion when you want the hair fall to decrease.
Mhm.
So to have a very good hair, having the balanced diet with proper micronutrients or nutrients or mineral fatty acids, essential fatty acids,
Mhm.
along with
Mhm.
phytonutrients, if you take collectively daily, then
Mhm.
definitely it will make your hair very shiny, healthy, and grow.
Mhm. Not only face but also skin. Yeah.
And also nails. Nails
Nails
actually are the
also.
very important.
Yeah, 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 yeah. Nails are also very important.
Mm.
Yeah, so quite interesting, doctor. So, like after hair loss, and now there is another very common problem which is faced by all of us is the dandruff. And sometimes people take care of dandruff. Sometimes they think, okay, it will go with 2, 3 washing, and then it will be fine. So, but can dandruff be serious, and does dandruff cause hair fall?
Yeah, of course, dandruff causes hair fall. So basically, if you go be deep into the dandruff, what is this dandruff? Like there's something called Malassezia furfur, the fungus,
Mm-hmm.
which
Mm-hmm.
actually loves the sebum. Actually, our hair follicle, it is connected to one sebaceous gland. So its
Mm-hmm.
work is continuously to secrete the oil to keep our
Mm-hmm.
scalp and everything like conditioned or something. And
Mm-hmm.
but these Malassezia furfur, when the climate is very bad, like
Mm-hmm.
in dry times like winter, actually they get
Mm-hmm.
exaggerated. Also some nowadays the monsoon time,
Mm-hmm.
the hair is actually sticky so much because of the excess moisture
Mm-hmm.
content in the places like a few
Mm-hmm.
areas.
Mm-hmm.
There is excess growth of fungus. This fungus
Mhm.
actually loves this sebum and it will break down that sebum into free fatty acid, which causes
Mhm.
inflammation basically.
Mhm.
And this, if it is only continuously giving flakes and itching,
Mhm.
it is called dandruff. If it is
Mhm.
severe enough to cause redness, inflammation, and some elevated lesions or something, it is called seborrheic dermatitis. This is
Mhm.
so much severe because it will go and hamper the growth of the hair. So
Okay.
definitely it causes the hair fall. And once
Mhm.
some when you go deep into the treatment of this dandruff, there's something called
Mhm.
ketoconazole. There is
Mhm.
many studies saying that
Mhm.
if you use this ketoconazole, it actually
Mhm.
promotes hair growth,
Okay.
not only by killing this fungus, but also there is
Mhm.
some other mechanisms by which it acts to grow for. Okay, so better
Okay.
always stay out of this dandruff and to
Mhm.
get the treatment from a dermatologist. You
Mhm.
can actually help grow your hair.
Mhm. So even for dandruff, we should take care of it instead of letting it grow and make it more worsen. Quite interesting, doctor. So like there are also like we talked about this plant extract and so many things are on social media, and there are also very common chemical treatments available in market like hair botox and keratin treatment, and mostly females are very fond of these kind of treatments. So are these treatment like doable or not doable? Like what is the fact behind this? Can you please enlighten us?
Yeah, see, nowadays it is like trending to get this
Yeah.
hair straightened hair, like shiny, bouncy, like hair.
Yeah.
So
Yeah.
people every 6 months they're getting some treatment called keratin treatment.
Mhm.
If you go and ask that guy like you want this keratin treatment, then he'll counsel you to get the hair botox treatment. Like you'll tell, if you do get this hair botox treatment, like I don't know why they kept this botox name for that. Botox is something different, but they named it as hair botox, and they'll tell that if you get this done, then the results will stay for long. Like it is very attractive thing, because people will doesn't think about the what happens in the future. They want to get good things for now. Okay. The but if you ask me one deeply, what is the bad thing that is happening, there are some researchers which are published nowadays. If you go for hair keratin treatment, actually formaldehyde and hair glycoxylate, some serums are applied for your hair and they kept for 15 minutes. And because of very strong concentration of these things are applied, actually they get absorbed into your body, and they're forming the glycoxylate crystals in your kidneys, and it's leading to the chronic kidney failure in many females. Okay. So instead of going for sudden looks and everything, okay, if you ask me, like okay, today you are having some function, you can actually heat and steam are the best things to make your hair straight. Okay, that too by just applying some hair heat protective, okay, sprays. Apply some heat protective spray, just straighten it with just heat and steam. There what happens, the hydrogen bonds actually they get straightened up and they'll make your straight smooth. It can be reversible just by, if there is some sweat, if there is some water, it will get reversed. It is simple, not that a big issue. But if you want long lasting things like this, you are just going and harming your kidneys so badly. Actually, why I am telling this, because I myself went to this hair treatment. Like I want to know what is actually happening there. I got my hair straightened a few days back, and after that, I had very severe renal pain, kidney pain. Then I did the CT. I found that one small 2 mm oxalate like stone was formed. Like I was like clear live example of why you should not take all these treatments, because this is like females, men only are having so much problem. Like female, they use more concentration because of the long hair. Like take more time they'll apply and keep it. So you just go and approach a dermatologist. He will actually plan how to maintain your hair, like so you can prevent it from this or that.
So actually, these are very attractive package for short duration, but in longer times, it can lead to a lot of problems. So very interesting, doctor. So like after these chemical treatment, one thing is very like you also said, Adivasi oil, and not only Adivasi oil, but also like our mothers at home, they give us like hair jumping and all, and massages, and they tell us that use oil frequently, put oil and sleep. Next day, your hair will be longer, stronger, thicker. So, what do you think? What's the fact behind this? Oiling hair is a boon or a bad?
See, oiling is actually contradictory statement, because all the some dermatologists has different opinions. It like mixed debate between whether you should oil or not oil or not. But I'm telling one simple funda. Okay, if you are living some South India, like our places, like very dry places, like your most of the time your hair is dry and coarse and very damaged like hair, there we actually prefer oiling. Okay, so because oiling is actually very simple thing. Like if your body, if it become dry, so what you do, you apply some moisturizer. Like if you see your hair, the hair will produce its own oil to make it water moisture. Okay, but if you go deep, the outside hair, if you go to see the outside hair, the oil which is secreted, it can't reach the outside hair. So for that, we tell that oil is a very good conditioner to apply only the outside hair, not for applying here and doing continuous rubbing massages. Nothing will come out of it. Okay, you're just going and blocking the other sebaceous gland. You are causing other problems. Like if you see so many people, they comes with acne here when applying so much of oil. This is called pomade acne. Pomade acne occurs when your sebaceous ducts are blocked by oils and other cosmeticals and everything. So if you're having fine and oily hair, like already it is oil secreting continue, you should not apply oil. Just go and wash the oil already secreted, because it will go and attract other dirt particles from the outside, and excess if you more apply more and more oil, it will just going to make it harm only. And people with dandruff, please ever never apply oil, because oil, the fungus, what I told, it likes the oil, it will more break it down and make it more dandruff. This is my take
Okay.
on this
Right.
oil. Oil is like some people, okay, you can apply 1 hour before head bath and just take a head bath and okay. It's a very good conditioner. Oil, very good conditioner, coconut oil. Okay, just apply for the outer strength, not for the inner scalp and everything. Then it will be very good.
Okay. So thinking, applying oil and sleeping and thinking that next morning my hair will be longer, it's completely myth. Yeah.
So what good you'll get by sleeping? You'll go and sleep by oiling, and you're damaging your pillows and everywhere, and you actually is also attracting all the dirty things and everything. And
Mm.
that oiling thing you do on a dirty scalp. Okay,
Yeah.
it's not that you are applying from a healthy scalp because of all
Mm.
the outside things. You'll roam from morning to evening outside, and all the dirt pollution, and you come at night, and you'll just apply the oil and you'll sleep. Again, you're making the dirt to settle and block your glands only.
Okay.
If you're
Quite
applying a
interesting.
healthy scalp and everything is good, but you're applying on the dirty scalp, again you're applying oil, again attracting all the dirty particles. This is no good.
Yeah. Very interesting, doctor. Now, my favorite part. Can you give us some important tips for healthy hair?
Yeah, healthy hair, proper diet, always take the proper diet, always include the correct portion of the protein that is required because hair is nothing but the protein. If you eat the protein, the hair will come, and you will include the vitamins that I have mentioned like biotin, zinc, what according to the RDA, whatever you buy, see the label padega
Mm.
India, and see
Mm-hmm.
whether you have the required RDA required for that, then only you
Mm-hmm.
take them. Okay, and when you main thing it is shampoos and conditioning. I want to tell shampoos what you're using because the oil is secreted in our scalp. Now it has to be removed. That is
Okay.
how the nature. Excessively it is
Mm-hmm.
producing. You have to wash it regularly. Okay. Then you
Mm-hmm.
have to why with shampoos. Shampoos something called sulfate free shampoos you have to use because sulfate will
Mm-hmm.
damage your hair.
Yeah.
Hair actually has outer layer called cuticle, which actually
Mm-hmm.
gives the protection to your inner hair. What is there? It will give the protection
Mm-hmm.
to the inner hair. This cuticle,
Mm-hmm.
if you are using the harmful shampoos and all, these cuticles will get weathered off, like they will get
Mm-hmm.
open off. It is actually interlocked, it will get opened off. So if you do shampooing also, I tell after shampooing, please do conditioning. Conditioning is the one good thing which can make your hair be healthy for as many years as possible. Like after doing shampoo, use the conditioner. Conditioner actually it consists of all the collagens, keratins, and many fatty acids and everything they'll make it. So it actually goes and bind where the hair shaft is damaged. It goes and bind there, keep it strong.
Mm-hmm.
So regular practices are like do the shampoo. After that, you apply conditioner and again has to wash it off. Then you can easily comb the hair and you can easily style it according to your wish. So main thing to keep your hair good looking is shampoo, conditioning. Nowadays, two-in-one preparations also will come. Some people, like if people are having eczema, sometimes I will tell with emollient only wash. Like use that emollient, use that moisturizer to wash your body. Same way you tell, don't use shampoos. Directly you wash your hair with conditioner. It is actually given in our main book, like some conditions like where dry scalp is very damaged because of the scalp hair is also damaged because of the shampoos and all. Just advise them use your hair with conditioner without using any shampoo. It will along
Okay.
with the water it will remove the dirt. Very simple fun.
Okay. Okay. Quite interesting, doctor. So even the conditioner is very important, not only shampooing the hair. Yeah, so this discussion was very informative, doctor. I'm sure our viewers have found the session very helpful. So can we take some live audience question?
Yeah, before that I want to tell something.
Yeah.
Actually, hello, can you all hear me?
Yes, 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 doctor.
Recently, we had a very bad incident happened in our medical fraternity. Like one PG resident of a chest medicine, she was
Mm-hmm.
brutally raped and murdered while she is doing the duty at midnight in an hospital in a government
Mm-hmm.
prestigious college in a very good city. Like in a very
Mm-hmm.
good city, if you have no safety for a doctor who is working at night duties, it is
Mm-hmm.
very bad thing that India is going towards. I just
Yeah.
want to give my condolences for her, and I just want to know the audience, please. Actually, or most of the people they just make the highlight things
Mm-hmm.
wherever happens. But when something happened to our medical fraternity, like it is not very brutal thing to listen.
Yeah.
Also, like see, we have seen the different injuries that has happened to her in the different
Mm-hmm.
parts of her body. It was given like how
Mm-hmm.
much pain she has gone through before this.
Mm-hmm.
Like it is not acceptable thing.
Yeah, it
We
is
can
not.
just want government to do their things and actually punish the what the people who
Yeah.
are doing all this.
Yeah, yeah. Even they punished that person. It's better that society create awareness about this so that such cases does not happen at all. Instead of catching the after having the incident happen, people go catch them and punish them. It's better. Precaution is better than cure. We should aware
Yeah,
people that
see,
such things
nowadays,
are
okay,
no
always,
use.
if you don't tell me that I'm going off the topic, but one small thing I'm
Yeah.
telling, like nowadays, people used to tell like females are exposing that this is the reason for rapes and all. But what she has done, she's doing a duty at the night in midnight in a hospital. Nothing like what you can expect from this. See,
Mm-hmm.
how can other doctors, like my fellow doctors, my colleagues, and all, they work at midnight duties, they go for on calls at night, 3 o'clock, and do whether they feel safe or not. See, this
Yeah.
government should make some rules to make security for all the people. Like,
Yeah,
just
even the
hope that
hospitals should
industry,
take participate in this, increasing more security for the females who work at the night.
yeah,
Yeah, yeah. Yes, doctor.
yeah, I can
It's
take questions if someone is interested to ask any question, I can answer them.
yeah, yeah, yeah. So I'm so sorry this happened, and I hope through this platform people create awareness about this. So I'll take one question from our audience. The first question is, Doctor, can pregnancy lead to hair loss in women? Asking on behalf of my sister.
Yeah, I have explained this now, like pregnancy, what happens
Yeah.
in the during the pregnancy time. Actually, this anagen cycle is prolonged, like strongly it is prolonged because of the hormonal effect and
Mhm.
all. When suddenly pregnancy ends, all the hormones will go back to normal. Suddenly, hair also doesn't know what to do, and suddenly it go
Yeah.
shift back to telogen phase and start shedding.
Mhm.
This postpartum hair fall will actually be for 1 6 months and all. It can be reversed
Mhm.
by actually improving your nutrition and all by taking all the supplements what I have explained.
Mhm.
It will be
So
reversible
it's for the
automatically.
timing, and later on it can
Just for
be.
the time being, like how you think a pregnancy is a precious thing, the hair fall is
Mhm.
also precious.
Another question from our audience is, Doctor, I travel a lot and from one country to another country. So before I was in India, then I went to America, and now I went to Germany. And place to place change can lead to hair loss. And is it water, or is it the weather, or what is it? And can we control it?
Yeah, definitely it is because of the hard water or soft water. Water also matters. So sometimes I
Mm-hmm.
tell my patients just buy one 5 liter of Bisleri and keep it and use that to wash your hair instead of buying thousands and thousands worth of hair serums and all. Use some Bisleri
Mm-hmm.
water to wash your hair a little bit. Like, and water is also definitely as a pop, and also the climate. Climate is definitely a thing that actually affect your hair. Okay, I told you like
Mm-hmm.
some people like because of the excessive moisture. I'm staying in this northeastern part.
Mm-hmm.
Northeastern,
Mm-hmm.
there is too much of humidity and too much of everything. Because of too much of humidity, always my glands are secreting so much of oil and it's keeping it sticky. There'll be irritation. If I don't wash it every two once in 2 days, there will definitely cause hair fall and all. But if I go to my south place, I can be happy because there is no humidity and all. Hair is always dry, dry, dry.
Mm-hmm.
Depends on climate and everything changes. Just
Okay.
take the
Okay.
proper care.
Okay. 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 Another question from our audience is, hi doctor, you said that keratin is a protein, and my doctor told me that I need to eat lot of protein. So is there any capsules of proteins which are available, and which I can eat and get my protein in my diet?
No, actually, protein is also very. It's not like in Instagram they show something you eat this, you'll get like protein. Protein powder should be carefully taken
Mm-hmm.
because protein, if you take excess protein, it can actually damage your kidney and all. So okay. So just
Mm-hmm.
include in diet, like what are the protein rich sources? Like if you are non-vegetarian, eat so much of chicken. Chicken is a very good protein source. And if you're a vegetarian, you go for the vegetarian protein sources, mainly the soya beans and nuts. These are all very good protein sources. Just
Mm-hmm.
focus on this. Don't take any farm nutraceutical protein things. Like protein
Mm-hmm.
powders are available. So many things like all the gym freaks and gym enthusiasts, they always take the protein powders and all. But be cautious while taking that that you can't take excess of protein. Like I will get if you eat excess of protein, I'll get excess of hair. It's not like too
Mm-hmm.
much of anything is poison.
Yeah.
Okay, you
Mm-hmm.
have to keep in your mind.
Yeah. I'll quickly take last question from our audience. Hi doctor, I have androgenic alopecia. My age is 45 and I've tried everything possible but my hair is not coming back, and can I take your appointment and how to take your appointment? What should I do?
See, if you are from Assam, I'm available in Assam now. After 1 month, I'll be available in Karnataka. Like if you
Mhm.
are any parts near me, you
You
can
can
consult
give
me
me.
in Instagram. I have an Instagram page like Dr. Nalla Skincare. You can
Mhm.
follow it and you can get all the updates of the updated videos. Also, I'm posting about the new procedures, what is happening in that. You can
Mhm.
DM me in that, and I'll let you know where to
Mhm.
consult. Okay.
But can androgenic alopecia people who are having this, can they have their hair grow back?
Yeah, I
This.
told now there are multiple treatments nowadays, like PDO threads. I can give them PDO threads or exosomes or PRP therapy, GFC therapy, which all stimulate the hair follicles. If
Mhm.
completely it's gone, like after
Mhm.
using minoxidil and also, then we can easily go for hair transplant. Hair transplant is like best thing to do, and if you can manage and handle it, it's not a big thing.
Okay, I'll take one more question because this viewer asking me, please take my question. Can we slow or reverse gray hair?
Yo, actually, one if you want to tell me about the gray hair is called canitis. Canitis,
Mm.
if you divide into something called premature canitis. Premature
Mm.
canitis matlab, less than
Yeah.
16 years of age, the people, if they are having white hair, like small people, they multiple
Mm.
times they come.
Mm.
There's something called calcium pantothenate. Okay, is the
Mm.
thing that is actually deficient in such people. Because of
Mm.
that, they're getting gray hair.
Mm.
And something called, if they're having any thyroid disorders in the childhood also, it can also lead to gray hair.
Mm.
Like for them I can reverse it by giving the supplements and all, but once you cross like some 35 nowadays 30-year people, even I am having the canitis, I left it like this
Mm.
because you can't do anything. It is dead cells. Okay, the
Mm.
melanocytes
Mm.
are dead there. What you can do, like
Mm.
you can't reverse it when you cross
Yeah.
this certain age. It is not called premature canitis. Premature canitis is below 16 to 14 years below. People who call premature canitis is below 16 to 14 years below people who call
Okay.
premature canitis. Ours is canitis. Canitis is not like if you are having, but what I tell in our book, it is written clearly. If you are having only 1, 2, 3 white hair follicles, you remove that. Okay. Some people tell that if you remove one
Okay.
hair, it will cause extra 100 white hairs. This is not
Yeah,
like
yeah. This is very cool. It's not like that, right?
was
Yeah,
given
even
clearly in our textbook. Like if you have 1, 2 white hairs, just remove and throw it. See,
Mhm.
because of stress, stress is the main thing which is killing your everything in
Mm.
our life. If you're taking so much of stress, there is
Mm.
death to the cells of what melanocytes also will die.
Mhm.
The same way, our because of stress thing, our white hair is going. White hair is
Mhm.
coming basically.
Mhm.
So too much of
Mhm.
stress, too much of white hair. Like
Mhm.
if you remove one hair and if you take stress that already I got white hair, another white hair will come. Of course, it will die. Instead
Mhm.
of that, have a healthy lifestyle
Yeah.
and
Yeah.
don't think that you are having so much of white hair. People are calling you like already you
Yeah.
become thing or not.
But
Instead of that, you
yeah.
focus on
Yeah.
your life.
But even white hairs are now getting like a kind of a passion.
Yeah,
People
because
do
everything
get
has been
dyed
fashion.
their
Like
hair
some people make their baldness as also fashion.
passion.
Like they're
So
saying like
take it as a
Vin Diesel.
passion instead of feeling conscious about it. Yeah.
Actually, I'm proud of such people who are making this baldness as their or style icon or something. They're proud of what they're having.
Mm.
Instead of
Mhm.
taking unnecessary tension, like I'm having so much of hair fall,
Mhm.
there is no hair, what I should do, I can't live my
Mhm.
life, going into depression. Instead of that, living their life with their what is God has given them.
Yeah, yeah,
Okay.
yeah. Interesting, doctor. This session was really very interesting, and our viewers have enjoyed it. Thank you so much, doctor, for sharing your all expertise with us today and answering all the questions of our viewers today. I'm sure, and I know that viewers have liked the show a lot. Thank you so much, doctor. It was a delight to have you, and thank you so much for your valuable time.
Thank you.
Thank you, ladies and gentlemen, for joining us today and participating so actively and asking so many questions to our doctor. We'll take the appointment of our doctor again when he shifted to Karnataka with a new topic for hair and skincare, and we'll have one more very interesting session. Thank you so much, doctor, for your time, and let's sign off for today. Have a good evening.
Bye bye.